Charnley stem. Charnley is basically monoblock stainless steel stem with 22.2 millimeter head. It is a composite or shape close beam design. It is rough finished to prevent subsidence. It is considered a rod within two tubes, an inner cement tube and outer bone tube. Once inserted, cement should not move. Stability depends on on strong cement bond between the bone and implant. Any subsidence at the implant cement or bone cement interface represents loosening. Shear forces can cause cement fracture. Acts as a principle of single unit and 3-point fixation. The load is transferred from the prosthesis femoral head into the stem to the tip to the distal bone cement and subsequently to the host bone by passing the proximal femur, leading to stress shielding. As the proximal bone is not loading according to Will's law, it will lead to osteolysis. The principle of Charnley is low friction torque principle by using a smaller head of 22.2 millimeter. Addition of calcar will provide some amount of calcar loading and protect from stress shielding.